Kenya has recorded 15 more COVID-19 cases of a variant which was first detected in India. The 15 were from the 18 positive cases detected from samples collected at the JKIA. This, in addition to the 5 from samples collected at the Kibos Factory, brings to 20 the number of cases recorded in the country. And as Dorcas Wangira reports, the Ministry of Health is assuring Kenyans that the cases are not symptomatic and that isolation and contact tracing is underway. Take a look.
It was after subjecting travelers who had used JKIA as the port of entry into the country to both the rapid antigen test and an additional PCR test and further genomic sequencing that health officials were able to detect 15 more cases of the Indian variant. Wednesday, 5th May, the ministry confirmed it had recorded 5 cases of the Indian COVID-19 variant from samples collected in Kisumu.
15 were positive. Add to the 5 in Kisumu, that brings total Indian variant of B1617 cases to 20. Cannot be able to diagnose a variant at Bagathi or Mamaluzi or even KNH or Nairobi Hospital because you require genomic sequencing, which is a highly specialized test.
WHO on Monday classified the double mutant variant as one of global concern, with some preliminary studies showing that it spreads more easily, is moderately resistant to antibodies, but has low severity amongst those who are vaccinated. Health authorities in the country are yet to report significant adverse symptoms in those who tested positive for it.
We also took those 18 cases to the Kemri Wellcome Trust, Kilifi, for sequence analysis, and I have just received results that 15 out of 17 cases of those samples that were tested turned out to be the variant of concern that is now widely spread in India.
The exercise of tracing the possible people with those variants is almost complete, and they are a bit confined.
Kenya is still weighing its options of acquiring other WHO-qualified vaccines into its vaccine program. China's Sinopharm may have received WHO approval for emergency use authorization, but that is just one step before Kenya considers it.
It is one thing to get emergency use listing by WHO. There is always the other aspect that also the factory that will produce the vaccines must also be WHO pre-qualified. For example, Johnson & Johnson, it has received that, but the factory in South Africa is yet to get WHO pre-qualification, so all the doses are coming from outside Africa.
So far, 925,509 people have been vaccinated, with the ministry working to ensure that the remaining shots are in arms before the 28th June expiration date. Meanwhile, in the last 24 hours, 410 more people tested positive for COVID-19 from 3,799 samples, with a test positivity rate of 10.8%. 22 deaths have been recorded, bringing the fatalities to 2,950. The Ministry of Health projects another COVID-19 peak in the month of July, further urging Kenyans to exercise caution, owing to the fact that COVID-19 is still a present reality and Kenyans who received their first dose of the vaccine are still yet to receive their second dose of the vaccine. Dorcas Wangira, Citizen TV, Nairobi.